Bismillahirrahmanirrahim. Good afternoon to all of the medical community from Dr. Sadiq Ali lectures. This is me, Dr. Sadiq Ali. Alhamdulillah, by the grace of Allah, after a successful USMLE first aid, step 1 and step 2 CK courses, we are going to launch a new course that is very, very important. That is pathology. And in the pathology, we are going to discuss the whole book that is Pathoma because it is a very, very well pronounced and very important book that is all the medical students and graduates they are demanding that sir you can start Pathoma because this book create a lot of impact in the medical career. This book provides a lot of concepts and this book provides a lot of data regarding your basic knowledge and clinical knowledge. So today just I want to put a very basic demo lectures on Pathoma book that what are the contents we are going to cover in this book. And today just I will give a little bit 10 to 15 minutes, a very brief discussion on a topic that many students, those who are new to us and new to our platform, they just get to know that what are the way that we can teach on that and what are our teaching methodology. If someone like it and if someone love it, and those who want to study pathology with us day by day and every day, then you can contact us and we will give you a lot of knowledge. And those who can enroll themselves, register themselves for Pathoma book classes with Dr. Sadiq Ali platform, they will get 50% discount before 12th of December because our classes will be on regular basis, online classes. They will be started from 15th of December. So majority of the students from different countries like India, Bangladesh, Nepal, Afghanistan, Pakistan, majority Asian country, we have more than about 8 country students. They are taking classes with us, and this is because of you guys trust on us, and we try our best to provide you more updated knowledge regarding the medical field. So straightforward, now we are going toward that what is pathoma, what is pathology, and what we will discuss in this book. So now let me tell something about its contents. Okay, what are the contents we will discuss in this books? So let me told you in this book regarding the contents. The first chapter we will discuss in greater detail, that is the growth adaptation, very important. And this topic carry a lot of basic concepts regarding pathology. So growth adaptation mean cellular adaptation. If there is any stress on the cell or injury, the cell undergoes some changes and it will adopt itself according to the situation. So we will discuss in greater detail what is the growth adaptation. After that, we will discuss cell injuries because if we start from the cell, we will know each and everything regarding human body because cell is the basic structural and functional unit cells of the human life. So it's mean the cell injury we will discuss its causes, its injuries like reversible cell injuries and irreversible cell injuries. And if the stress is so prolonged and so severe, if the cell cannot able to repair back, the cell will undergo cell death. Now, cell death again, that is two types, like natural programmed cell death, and we will discuss accidental or pathological cell death. And I hope, and I'm damn sure, because it's a very basic, many of the medical students is beware about apoptosis and necrosis. So we will discuss these two conditions in a greater detail. Now we will just going toward the content. So when we start this chapter, so we will discuss these two in a greater detail as well. Then chapter 2, we will discuss inflammation like acute and chronic inflammation and their mediators, inflammatory disorders and wound healing. If there is any injury to the tissue that can create wound, now it is the nature law that whenever there is injury, the body try to compensate and the body try to heal that area into normal physiological form. So now we will discuss wound healing in the second chapter at the end and some of the factors and some of the very common factor that can cause delayed wound healing. So we will discuss those as well. Principles of neoplasia. Those doctors who love to work in oncology, like cancers, so they must know their basics, like sarcomas, carcinomas, like benign, malignant. We will discuss each and everything, their oncogenes, proto-oncogenes. We will discuss those things in neoplasia. Then homeostasis and related disorders like bleeding disorders we will discuss like primary hemostasis. Hemostasis means if there is any injury in the body and there is loss of blood. Now, the mechanism through which the body can try to stop that bleeding, that is called hemostasis. It may be achieved via the platelets or clotting factors. Then we will discuss their related disorders like red blood cell disorders, that is a very familiar cell, that is RBC. We will discuss anemias because when RBC decrease and there is decrease HB, it will lead to anemia. And sometimes RBC is very high, that is very high, and HB will become very high. It make the blood more viscous, so it will lead to polycythemia. We will discuss both disorders. Next, white cell disorder like WBC disorder, we will discuss in detail. Vascular pathology. Vascular pathology means inflammatory condition that is called vasculitis. Even we will discuss aneurysm. These are the very major concepts we will discuss in this pathology book. Then cardiac pathology, like cardiac pathology, we will discuss congenital heart diseases. We will discuss, like for example, hypertension. We will discuss cardiomyopathy. We will discuss myocardial infarction. We will discuss angina. There are a lot of problems that is coming out from the heart, and we will discuss those one by one. Then respiratory tract pathology, very important. The classical one is like asthma, bronchial asthma, COPD, bronchiectasis, lung cancers. Lot of problem we will discuss. In gastrointestinal tract pathology, like GIT pathology, what is the esophageal disorders, stomach problem, like stomach gastric ulcer, peptic ulcer disease, gastric cancer, like for example IBD, inflammatory bowel disease, colon cancers. A lot of problem we will discuss in GIT. Like those I mentioned, they are very top, and I think most of the guys they are much familiar with those. But at the end of the lecture, we will going towards some other topic that is also included after gastrointestinal tract in the Pathoma book. It provides lot of data. As I told you, in this we will discuss exocrine pancreas, like the secretions which come from pancreas toward the duodenum and that help in the food digestion. We will discuss those pancreatic lipases, amylases, trypsin, chymotrypsin. We will discuss the role of gallbladder and liver pathology. In liver pathology, we will discuss hepatitis E virus, hepatitis B, and etc. So on up to hepatitis E. Sometimes the liver undergo cirrhosis and hepatocellular carcinoma like hemochromatosis, Wilson diseases. Next, kidney and urinary tract pathology. We'll discuss it in a greater detail. Female genital system and gestational pathology. A very important. Gestational is the word used for pregnancy. Like pregnancy induced a pregnancy related abnormality that is called gestational pathology. So gestational is a simple word used for the pregnancy. So whatever the problem the female facing in pregnancy, they are called gestational pathology. Then discuss male genital system pathology. We will discuss male genital system, female genital system before pathology. I will try my best to make it very easy and to make it very clear before that we will discuss its applied anatomy, applied physiology. And if you know the physiology, then understanding pathology just to eat a cake. Cake means that is very easy to understand. Before going to pathology, in each and every topic, we will do some physiology as well. Because I believe on physiology, those students whose physiology is very strong, they will do not face any type of difficulty level in understanding pathology. Then we will discuss endocrine pathology, like the most important pituitary gland, like thyroid gland, hyperthyroidism, hypothyroidism, like parathyroid, hyperparathyroidism, hypoparathyroidism, adrenal gland, like Cushing syndrome, pheochromocytoma, Addison disease, we will discuss. Then breast pathology. Breast pathology mean like local infection, mastitis, like some cancer, ductal carcinoma, invasive lobular carcinoma, ductal carcinoma, Paget disease of the breast. Very, very important. And with the breast, if the cancerous cell metastasize and they spread to other part of the body, they may affect auxiliary group of lymph nodes. So we will discuss those in breast pathology. Then central nervous system is a very, very important system. Central nervous system, we will discuss CNS pathology and we will discuss PNS pathology. CNS stand for central nervous system, and that is most important. And PNS peripheral nervous system. So both these are the NS nervous system. So in CNS, we will discuss like the brain pathology, like meningitis, brain tumors, brain abscess, hydrocephalus. We will discuss all those in spinal cord, like poliomyelitis, transverse myelitis, that are discussed, we will discuss in the spinal cord. Then musculoskeletal. So musculoskeletal pathology will discuss a lot of anatomical region. Musculoskeletal, it's mean like muscle problem, myasthenia gravis, Lambert-Eaton myasthenia, like rheumatoid arthritis, skeletal system. Because skeletal system, like that system may you people can refer as rheumatology. It is the study of joints and their related disorder, osteoarthritis, rheumatoid arthritis, gout, pseudo gout. We will discuss those in detail as well. And then last but not the least, skin pathology. Like what are the diseases that primarily affect the skin? Like in the skin, we have three layered epidermis, dermis, and hypodermis. In each layer, there are specific diseases you people must know about it. So in skin pathology, you must know like furuncles, carbunculus, pemphigus vulgaris, bullous pemphigoid. These all are the autoimmune diseases of the skin. So just you people before going to start something, you must know what are the contents in that subject. Either it is good for me or not good for me. Either it is according to my target or not. So before going to start anything, you must know the content table that what thing we are going to discuss. So I mean from 1 to 19, those contents cover each and every part, like including general pathology as well as this is systemic pathology in greater detail. And we offer the fee, which is very, very less. So you people must know about it that pathology is very, very key. And pathology, if you know it, you will be a good physician. You will know the understanding of how to diagnose a disease. So before that, I just wish that I go for one topic a bit that you people just learn that how we can teach. So because of that, if someone want to go with us side by side in pathology, they can contact me. So we will add them in a proper lectures. So I'm just going to tell something about growth adaptation. As a demo lecture, growth adaptation. Now, basic principles say an organ is in homeostasis. Homeostasis means that the organ try to keep their internal external environment near to constant with the physiological stress placed on increase or decrease or changing in stress on an organ can result growth adaptation. Now the basic principle say if you put an organ in under physiological stress, normal stress, that organ will try to maintain internal or external environment nearby constant. But if you change the stress or if you change the stress regarding duration or severity, then the organ or the cell undergo increase in size or decrease in size or changing of epithelium. So depending upon the stress, whatever the changes that is occurring in that organ, they will be referred as a growth adaptation. Now growth adaptation we will discuss one by one. In that we should start first hyperplasia and hypertrophy. Now, let me discuss something special about hypertrophy and hyperplasia. That it is make it very very easy to understandable. Now, focus here. For example, now here we should go for it. The basic concept. Basic concept mean that here hyper. Hyper is the word used for increase. Hyper mean increase. Now, if we use the word hypo, hypo mean decrease. Hypo mean decrease. So hyper is increase and hypo decrease. If we use the word A, like atropia, A is the word used for absent in medicine. A for absent. If we use the number plasia, plasia mean number. That is called a number. Now, for example, if we go for it, hyper. So hyper mean increase. Plasia mean that is number. So that is simple. Increase in the stress lead to increase in number of the cell. That is called a hyperplasia. So hyperplasia mean that it is the increase in the number of cell. If we talking about the number, focus we are dealing with hyperplasia. That plasia mean number. But if here you people can focus, that is hyper mean increase, trophy mean size. If we deal increase in the organ size, if we dealing the size, it means we are dealing with hypertrophy. Now, what is the simple definition of hyperplasia and hypertrophy? Increase in the number of a particular cell in the organ, that is hyperplasia, but increase in the size of an organ is called hypertrophy. Now, hypertrophy occur because of gene activation, protein synthesis, and production of organelle. Now, let me tell you how hypertrophy occur. Now, I giving a very classical example, and you people, I think, must learn a lot of things from it. For example, this is a heart. A human heart has four chambers. This is the right atrium. This is the left atrium. This is right ventricle, and this is the left ventricle. But as we know from the basic, the most powerful and muscular chamber which can contract and supply blood to all part of the body, that is called a left ventricle. And left ventricle, from here aorta is arises, and in between the left ventricle and aorta there is a wall known as a aortic wall. Now you people think if a patient has healthy, now the left ventricle contract against this aortic pressure in a such effort that it can push the blood to all part of the body. Now think about a patient has hypertension, a patient has high blood pressure. Now there is more pressure in the aorta. Now to overcome this high pressure in the aorta, the left ventricle has to pump more with more pressure. Now when the left ventricle has to pump more, then it will try to increase its size because in the cell it has mitochondria. Mitochondria is the powerhouse of cell. Now when the left ventricle contract against this high pressure, it will try to increase its size. So overall chamber size is increases. Why? Because the cell tried to generate more mitochondria. More mitochondria number will provide more energy to the cell, and more energy provide will more push to the blood, and it will go toward the body. So left ventricle hypertrophy will occur if there is a persistent hypertension. It's mean hypertrophy because of protein synthesis, gene activation, and production of organelle. The most common organelle that is produced in hypertrophy, that is mitochondria for the generation of more ATP. And hyperplasia involve production of new cell from the stem cell. Hyperplasia and hypertrophy generally occur together. Like, for example, we will say the hypertrophy and hyperplasia in some area may normal, in some area it may abnormal. And in some area, in one organ, hypertrophy and hyperplasia may occur together as well. Like, for example, uterus during pregnancy. Now, if you see in the uterus, when the female is get pregnant in the uterus size is increases as well as the uterus number of cell is also increases. The increase in the size, if we focus on the size, it's mean hypertrophy, and if we focus on the cell, that is hyperplasia. But within the pregnancy, if we are talking about uterus size in number, that will be physiological increase because hyperplasia and hypertrophy may be physiological as well as pathological. Another thing, like lactating mother breast. If you're talking about normally in a lactating mother, the mother who feed to the baby, so lactating mother breast. Now here is also breast increase in the size, that is breast hypertrophy, and there is increase in the milk producing gland, there is hyperplasia. But some permanent cell, like permanent tissue, cardiac cell, skeletal muscle cell, and nerve, they cannot make new cell, so can't they undergo hypertrophy only, but not hyperplasia. For example, brachial, like bicep muscle. If you goes to the gym and if you lift heavy weight again and again, you are pressurizing bicep. Now, bicep muscle undergo hypertrophy but not hyperplasia. And for example, cardiac myocyte undergo hypertrophy, not hyperplasia, in response to systemic hypertension. Now, here we are talking about already in the hypertension, when there is more pressure in the aorta, the left ventricle has to pump more. So, this muscle, cardiac muscle, undergo increase in the size. Now, when the muscle size in the left ventricle increases, it's mean overall left ventricle will increase, and that is left ventricle hypertrophy. So now the size of ventricle increases, but number remain same. Now, if we are talking about pathological hyperplasia, like endometrial hyperplasia, what is endometrial? It is the inner lining of the uterus. In a female reproductive system, the inner lining of the uterus is called of endometrium. An increase in the number of cells in endometrium is endometrial hyperplasia can progress if left untreated. Now, hyperplasia is totally a reversible condition, and if we cannot treat on time, left untreated, it may progress toward dysplasia. Now, dysplasia is a disordered increase in the number of cells. Hyperplasia is a step before dysplasia. Another, and if dysplasia do not treat, eventually lead to neoplasia, which is cancer. Now, one point to remember, which is very, very important, a notable exception is a benign prostatic hyperplasia, which does not increase the risk of prostate cancer because BPH is something else. So now here two things we understand that in some hyperplasia, if left untreated, will lead to cancer. But some conditions are there when there is hyperplasia, but if they do not treat, still they cannot lead to cancer. So these are the topics, these are the new things you people must know for the exam, and they will ask frequently in multiple exams. Now, just this is a simple demo I want to give you guys. We will discuss like that, and we will discuss this whole Pathoma in English, and that everyone can improve the English. Everyone, whenever reading the MCQs in different exam like MRCP UK, like MRCP Ireland, yeah, for example, like USMLE, flag, like any type of exam, understanding English is the key to pick MCQs in the question. Now, this type of thing we will discuss in the whole pathology. It's a 3 months course and daily basis. We will provide 2 to 3 lectures from 15 onward, and those who can pay their fee, registration fee before 12th December, they will get 50% off. So come to join us and learn the new concepts in pathology. And one more extra thing at the end of this, I will provide exam-oriented MCQ on pathology as well. So hope you guys like this lecture and you learn something. Thank you so much for hearing me. Please subscribe, like, and comments on my YouTube channel, and we will discuss these pathology lecture day by day on daily basis from 15th December. So do not waste time. And another question, majority student ask where our lecture will present. Those who will pay the fee, they will send the name and Gmail ID. We will create the username password. We have own website, and on that website, the recorded lecture will come daily unto them. Thank you so much, guys. Allah Hafiz. See you soon. Jazakallah.